Welcome, everyone. My name is Sarah Ray from the Bloomfield Public Library. Thank you for joining us today to learn about how to communicate with our doctors better. So I'm going to turn this over to Gabby to get us started.
Wonderful. Hi, everybody. My name is Gabby Ceccolini. I am the director of the Standardized Patient and Assessment Center at the Frank Netter School of Medicine at Quinnipiac, and I teach people how to be patients. I'm going to share my screen with you so we can go through some slides. Okay, so as I said, I teach people how to be patients. Today, a couple of quick disclosures. So I am not a medical provider, so no medical advice will actually be given. I do talk about some scenarios, but they're all for examples only. And throughout the presentation, I use the term doctor, but this is interchangeable with any advanced practitioner like a PA or a nurse practitioner. So at the end of today's presentation, you are going to learn the 3 parts of a medical visit. There are 3 parts: how to prepare for your upcoming visits, how to communicate more effectively with your doctor, and how to experience a true sense of partnership, which is what medicine is meant to be today. So I really do teach people how to be patients. They are called standardized patients. I refer to them as SPs. They're also called patient actors, simulated patients, patient instructors. So what these people are, they are hired and they work for the university, and they are trained on how to be various types of patients. So, for example, a patient with headache or a patient with back pain, so that medical students, so future doctors, as well as nursing students and various health science students like physical therapy students, athletic training, sports medicine, social work, have an opportunity to practice communicating with various types of patients in a safe learning environment. So SPs can play the part of different patients or family members. And if they're portraying a patient with headache or back pain, they're really simple. So young learners can walk in the room and in 15 minutes practice doing a history, physical exam, and communicating compassionately and empathetically with the patient with headache. But we have cases all the way to somebody playing the part of a family member who has to have an end-of-life conversation for a spouse, or a patient who is receiving bad news, so that the students can practice really advanced communication skills before they go out and talk to real patients. The SPs oftentimes give students feedback on their communication skills, and we follow these standards of best practice. There are trained ways that your doctor is trained to talk to patients. And it's all about the time spent face-to-face in the exam room. That's the focus of my takeaways today and the presentation today. In the complexities of healthcare, the focus that I have is the 15-minute medical visit. The time that you sit face-to-face with your doctor in an exam room, and in making sure that you are prepared, that you're confident, that you know how to communicate with them, you know how to be engaged with them. Because healthcare has changed. I'm sure most of you agree with that. Gone are the days where your doctor comes to your house or even sits with you in an exam room for 30 minutes and really gets to know you. Now we have about 15 minutes, and it's very fast paced and it's very quick, and doctors are stressed and they have a lot of patients, other patients to see. And so you really need to know how to maximize the time of that visit. Patients cannot just show up. It doesn't work if you want to receive the best care possible. Right, as I mentioned, doctors are trained for 4 years. I work with the medical students, but I also work with actual practicing physicians who come back and train on communication. So they're trained on how to communicate with patients. Patients are born, you get sick, you go to the doctor, right? I feel sick, help. And that's okay. If at the end of the next 20 minutes or so, and what I say, you still just want to show up to the doctors and say, I don't feel well, help me. That's fine. You can do that. The healthcare system will work, right? That's how it's been done for many years. But here's why I think you shouldn't do that. To every medical visit, think about those 15 minutes, the time you're sitting there. There's the patient, there's the doctor. Patients are made up of many things that contribute to your health. So yes, your physical health, your mental health, but your lifestyle, your finances, your beliefs, your family. There's so many aspects of your life that contribute to your health and that matter. Doctors to every medical visit are bringing their years of expertise, their training, their network, their colleagues, their hundreds of thousands of patient contact experiences. The puzzle pieces are intentional though, because it also shows that they're human beings, right? That your doctors are not mind readers. Your doctors are not robots. They're human beings who put their pants on in the morning and probably have kids and family and other stresses. But the hope is over the course of every one of your visits, at the end of the visit, this is the puzzle you want your doctor to have. So they get to the end of your visit and they say, okay, this is what's going on with you. And here's what we should do. What happens is doctors' offices are intimidating. People are just showing up and they're being passive. So they're waiting for doctors to ask questions. They don't speak up right away. And this is a problem. Oftentimes, because doctors' visits are intimidating, patients don't always speak up. They don't always have the information prepared. So when the doctor asks for information like, hey, when was the last time that you took this medication? Or when was your last colonoscopy? You don't always know. The other thing is sometimes as the patient, you have the information, but you don't feel like there's an opportunity to share it. Or you don't want to undermine the doctor, right? I shouldn't say this. I've done a bunch of research, but I shouldn't say this because that's not my role. And so you hold back information. The problem with this is at the end of a medical visit, this is the picture that your doctor has to make a decision on what to do next, right? They're coming to the end of the visit and they say, okay, I've gathered all the information that I have. And based on the information that I have and that I was given and the conversations I had, this is what I'm going to say to do. The problem with this picture is it can lead to a misdiagnosis. So every year in the US, over 12 million adults who seek outpatient care receive a misdiagnosis, meaning every year, 12 million adults who walk into a doctor's office and then leave are misdiagnosed. And actually, if you Google the term misdiagnosis, medical error comes up. The problem with this is it can lead to unnecessary treatments, right? So your doctor's figured out and told you something they think you have, but you don't really have, and you end up getting treatment that's unnecessary. Or there's follow-up visits because you're not being treated for what's really going on. Increased costs. That's aside from possible physical and emotional stress. And in extreme cases, this can lead to death. I think oftentimes people hear misdiagnosis or medical error and often their mind goes right to death, but it's possible. So why does this happen? A reason for this is a complete breakdown in communication. And when I say breakdown in communication, people that I often meet with blame the doctor. Well, it's their fault, right? They didn't ask me the right questions. They didn't communicate right with me. But the Journal of American Medical Association actually says that one of the reasons for a misdiagnosis is the patient's inability to provide an accurate picture of their health. The Journal of American Medical Association says it's the patient's fault, right? They aren't able to do this, which might feel frustrating or you might get defensive. But the thing is, the entire healthcare system and the model of care and what we train future doctors and current doctors on, the patient is meant to be involved. It's actually called patient-centered care. Most patients have not heard of this term, which blows my mind because the entire model of healthcare in the US is patient-centered care. It's how we train our future doctors. It's how we train, and the term that we use when we're training other healthcare providers, PAs, nurse practitioners, nurses. And to understand what this means, sometimes it's easier to understand the old system. So the old system is disease-focused or disease-centered, which is a patient walks in with diabetes, you treat the diabetes. This patient walks in with diabetes, you treat the diabetes. This patient walks in with diabetes, you treat the diabetes. That's the old way. Patient-centered care is you treat the individual. And so what that includes is doctors being trained on relationship building, trust. It's built on shared decision making. It really gives the patient a voice in treatment decisions. So much so that at the end of your visit, your doctor says, so you can take medications or get treatment or do surgery. And then you look at your doctor and say, well, no, you're the doctor. What do you think I should do? And they're going to say, well, you can get treatment or medications or surgery. What would you like to do? It's really designed so the patient chooses sort of what their best plan of care is. It's supposed to work together with the healthcare provider. This whole concept was developed in the 1980s and is considered the highest form of healthcare systems in the US. So it's fairly new, youngish. And as I say this, because it was developed in the 1980s, right, it takes many years to get in the system and for that new generation of doctors to be trained on it. So there's a bit of a generation difference that you might see, right? Older doctors were not initially trained on this. They were more trained on, I'm the doctor, here's what the right thing to do is, and here's what you should do. Whereas the younger doctors are more, this is more ingrained in the education first before they get out in the healthcare system. So they're much better at that inclusive communication. If this is all done well, right, the outcomes of this are better treatment, integrated care, better health outcomes, happier patients. So where I come into play, I sort of digressed a bit here, but this is all stuff that I love talking about. But where I come into play is patient-centered care is the healthcare model, right? And we train doctors and healthcare providers on how to communicate and how to roll this out and how to do this in the healthcare system, yet we've never trained patients on how to be the patient center of patient-centered care. We've never trained patients on, you have this big responsibility to be communicating with your doctor. They want you to communicate with them, and here's how. So that's what I'm going to show you. And I said they want you to communicate, and that's true. And I know so because a little bit about the research that I've done on this. So the standardized patients that I work with would often joke that they were better patients. They knew how to communicate with their doctor. They knew how to navigate their healthcare visits. And so I actually studied this and say, what is it that you do? And they gave me this list. Well, we come prepared, we speak up, we ask questions, we're concise because we know the doctor only has 15 minutes. We want to get a clear picture. I took everything that they said they did, and then I surveyed physicians and advanced practitioners and said, hey, what do you think of this? Is this helpful in the healthcare visit? And the doctor said, yes, very helpful. Yes, very helpful. Somewhat helpful. Yes, very helpful. So the combination of what these trained patients, standardized patients said they do, and what doctors said is really helpful in the healthcare setting is this. These are the three most helpful things: that patients are able to provide a clear picture of their health, their main concern, that they're honest and they're aware of their own past medical history, but also truthful and honest with their questions and concerns. They understand and adhere to their plan of care, all while feeling that the partnership, the visit is a shared partnership. I mean, doctors said that in the survey. Yes, this is very helpful if my patient feels like a partner. So these three things are broken down and translate into this very nice timeline. So I'm going to pause here. Your visit as a successful patient, and what I want the biggest takeaway from today to be, is to understand that at every medical visit, there is a beginning, a middle, and an end. And you will play a part in each of these. I'll show you. The shared partnership is seen here. So here's your timeline. Every medical visit that you go to, think about as you're sitting down, there's going to be a beginning, a middle, and an end. Every doctor has a framework. When they walk in the room, they're not just winging it. They don't just walk in the room and say, hey, how's it going? What's going on today? And just wing it. While it might feel like it, they don't. They have a framework. They've been trained a certain way when they come in the room. I mean, so much so that we train people how to do a proper introduction, which blows my mind that That's something we have to teach in medical school, but we teach a proper introduction. They're trained on, there's an intention for calming a patient down, having small talk, right? They have this thought process that they're working through to try and get to that complete puzzle, right? We think back to a few slides. They're wanting to create the most complete picture of your health in that short 15 minutes to come up with a plan of care to then get out and go see the next patient. And I'm going to take you through what you can do at each of these points. And it's simple. Here we go. So in the beginning of your visit, the doctor is coming in the room and they have to get a clear, organized picture and a full timeline of your main concern. To every visit, you have a chief concern, a main concern or present illness, new back pain, new headaches, new shoulder pain. I was doing a presentation yesterday and somebody said, well, what if I have many concerns? Why can't I talk about them? And kind of, again, digress a bit here, but insurance-wise, doctors can only bill for one concern. So they want to focus on one concern. If you go to the doctor, oftentimes patients are going with 2 or 3 concerns. So they're actually trained somewhere in the beginning to say, tell me what brings you in today. And you say, I have back pain. They're supposed to say, is there anything else you want to talk about? And you would say, well, I also have a rash. Is there anything else you want to talk about? Oh, my arm is weak. So up front, you can give the concerns you have, right? Here are the things I'm here for, knowing that they can really only focus on one. One thing that you might want to say is, here are my 3 concerns, which one should we focus on? Because doctors should be able to prioritize which one needs the attention first, right? Which one might be most riskful. And then unfortunately, they will say, why don't you follow up for your next concern? The other thing that might happen here is sometimes concerns are linked, right? You might be coming in for back pain. You also say, I've had a fever and a headache. And it's important for you to bring this up front because those 2 might be linked. Like you as a patient might see them as 2 separate things, but the doctor is like, oh, back pain and headache and fever, that's one thing. So bring it up front because there's nothing worse from a doctor's perspective. Going through the 15 minutes, they go to walk out the door and then a patient goes, oh, by the way, I also want to talk about blah, blah, blah. Okay, so that was just an added thing I don't have a slide for because as I said, I talked about it yesterday. But so in that beginning, in order to get a clear picture of your health, what they're getting is something called the history of your present illness. So your present illness, we'll say, is back pain for this example. So you're going to the doctor for new back pain. They need to get a history of your back pain. There's a few different ways that they have been trained on what questions to ask you to get a history of present illness. One of the ways that I want you to learn and that you will use is this term called old carts. So old carts is an acronym where every letter stands for something. So O is onset, L is location, D is duration, character, and so on. And each of the words, there's questions associated with it. So think about it. If I come in and say I have back pain, my doctor's going to want to know, well, oh, when did it start? Right? They're going to treat me differently if I say it started 3 years ago, or if I say it started 2 days ago. Where is the pain located? Is it in the middle of my back? Is it on the side of my back? How long does the pain last? And I might say, well, this happened 3 days ago, and I've been in pain for all 3 days. That is probably different than if I say, I first noticed the pain 3 days ago, but it only comes on a little at a time, and only when I get out of bed in the morning. Right? I don't need to know what that means, but this is information that my doctor is trying to figure out. They want to learn all there is to know about your main concern. This is something that you can prepare and that you should prepare before every visit. So that, and I'll give you an example. My husband was going to the dermatologist because he had a rash on his arms. And I said, okay, Jared, what are you going to do? He says, I'm going to go and I'm going to show her my rash. And I said, that's, in my mind, I was like, you can't do that. What are you going to say? Just hold your arms up. And I said, let's go through this. When did it first start? And this helped him because it sort of reminded him of all the things he did for this rash. He said, well, it started back in February. And, the treatment here, T, is what makes it better, what makes it worse. And so I said, remember, you took this cream, you went to your primary care provider and you took this cream. Like, we went through all this together. The benefit of this in any situation, there's a couple benefits, but one is if you're able to come in and give this information up quickly in the beginning, it's going to give you a lot more time for that middle of the visit to talk about all those other puzzle pieces. Also, if you prepare this, what it will allow you to do is something that I call my patient presentation. So what this looks like is you have back pain, you've prepared all those answers, and you can do this in the waiting room, you can do this the day before your visit, so that when your doctor walks in the room and says, hey, Mr. John, what's going on today? Rather than just saying, my back hurts, you're able to say, my back hurts. I've written down sort of all the timeline and the details of what's been going on. Like, here's what's going on. And you kind of preface this, so your doctor will tune into you a bit. And you say, my back started hurting 4 days ago. It happened when I got out of bed quickly. The pain is worse when I walk down the stairs. It's located here. You're giving this really great picture of what's going on with you. This is helpful for so many reasons, but what's interesting is during the research I did with the standardized patients, when they say that they do this, they say immediately they see a bit of a shift in the way their doctor tunes in with them. And they feel like their doctor might think, this patient cares a little bit more about their health. And this patient knows a little bit more about their health than the average patient. And because they care, right? So they feel like when people do this, that their doctor's actually tuning into them a bit. So, which is great. But also, if you're preparing this beforehand, you're not going to miss some of those things. That when they go to ask, like, have you done anything for your pain before? Patients forget the simplest things, right? My husband went in with the rash, and if the doctor said, have you done anything to treat it? He probably would have been, in the moment, the nervousness of the doctors would be like, nope, that's why I'm here. But after the fact, would have said, oh, I took that cream from my primary care provider, 4 months ago. That's information your doctor needs. That's one of those missing puzzle pieces. So when my husband did this, right, I said, Jared, go to the visit and say, I noticed the rash back in February. I went to my PCP. This was the cream she gave me. She showed the cream. He came home and I said, how did it go? And he said, the doctor literally said, if you showed up and just showed me your arms, I would have given you this. But because of everything that you've said, and because you've actually had this cream before, I really think it's this. And I think this is the medication you need. So use it for 2 weeks, 3 times a day for 2 weeks. You have to do that. And then call me if there's more issues. So I said, okay. And how do you feel? And he said, well, I trust that she knows really what's going on. And I actually feel like she's treating me the right way. And I'm going to follow through on this cream. I was like, there we go. This is what I'm talking about. So there's many benefits to this. I use this, and I'll move on. I use this so much in my own day-to-day life. And I'm so tuned into this that I would be sitting at the kitchen table and I feel a tickle in my throat. I just look back at my calendar and I'm like, oh, today's Tuesday, thinking that if by Thursday I have a fever and chills, that when it's time to go to the doctor's visit, I'm able to say, hey, on Tuesday, I noticed a tickle in my throat. Because again, thinking of the doctor's puzzle pieces, they've been trained to figure these things out clinically. So a tickle in your throat on one day, a fever 2 days later, might mean something different than if I just showed up and said, I have a fever and a sore throat and blah, 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 and I'm not able to give them that timeline. So this is where it becomes very helpful. So that's old carts, my patient presentation. Moving on to the middle of the visit. So the middle of the visit, you don't need to memorize this next slide, but the point of this, the doctor has gotten this history of your main concern. Now they're going to use their clinical knowledge and thought process to ask you questions that they think are relevant, that they would want to know, right? Family history and past medical history, your social history and lifestyle. I mean, there are hundreds of questions that they've been trained to ask, but they're only going to pull out what they think is important to know right? You have abdominal pain, they talk about it. And then in the middle, they might ask about like surgeries. They might ask about OBGYN history. They're human beings. They are trying to figure out that puzzle by asking questions they think are important. These are what I call the puzzle pieces. The important pieces here and how you can prepare this is kind of just being aware of it. There's not an expectation that you memorize all of this in your own care, or that you know what to come prepared with, but you can give a bit of thought to it. So you're going to the doctor. Some of the patients that I've worked with will go to the doctor and they kind of think through, like, when was my last procedure that I've had? When was the last time I went to the dentist? When was my last menstrual cycle? Like, they're putting down these kind of preparing information so that when the doctor asks a question in that middle, they're able to say, oh, my last visit was this, my last procedure was this, right? My mom was diagnosed with breast cancer at this age. These are things that usually patients don't have teed up. And so if you can think about this or review your history or give some thought to this, it will be helpful. The other piece, and why those puzzle pieces are often missing, is this is the hard stuff to be truthful on, right? How much do you drink? Socially, right? Especially those embarrassing things that are hard for patients to talk about, or things that patients feel shameful about, right? Alcohol, drugs, perhaps tobacco, maybe diet, exercise, issues or concerns at home, family dynamics, the things that as individuals can be hard to be truthful on, but this can only hurt your outcomes of a medical visit. And these things are very relevant. So it's really important that you become truthful in these situations. And one thing to make a note on, and then I'll move on, is some of you might be thinking about, like, well, what about my charts? What about health medical records? And a couple of things to say there is, for one, they're often not accurate. I have a very clean bill of health. I'm not on medications, or I don't have a very lengthy past medical history. And whenever I go to my doctors, there's always something in there that's not right. I'm like, no, not taking that medication. Nope, please remove that. But they're not always accurate. They don't always capture all of these things. So if you've had a recent death in your family, right? If you decided that you were going to buy some herbal remedy off of the website and start taking it, it's not like that automatically gets uploaded into your health records. And those are things that you need to be able to know to communicate. Or when your doctor asks what medication you're taking, you don't just say, oh, my standard medications, but you bring up, oh, I started taking this herbal remedy, right? So it doesn't just automatically update based on how you live your life. If it is very updated, an actual medical record is very complicated. It's like clicks within folders, within folders, within clicks. So when your doctor comes in the room to visit you, they haven't reviewed your full medical history before they come in. They don't open that electronic medical record and read it because it's very complicated. They will probably click into things that are relevant, right? You come in with chest pain. They're going to look at the medications you take. They're going to look at surgeries. There's certain things that they'll click into, but they're not going to click through everything. So you can't just rely on that. Now, with all of this said, if you have given some thought to all of this before your doctor's visit, and you think, oh my God, I think I know why I have headaches, or I think I know why all of a sudden I'm feeling bloated and have abdominal issues, right? Maybe you've thought about it. The fact that patients have beliefs of what they think is going on is actually something that doctors are trained to explore. And it's this term called patient perspective. What they should do is at some point in the visit say, so Mr. John, what do you think is going on? This is helpful for a number of reasons. For one, doctors are not trained or not paid the way that lawyers are paid, right? They're not paid for how long they work on a patient's case. They're paid for how many patients they see. And so sometimes as patients, you can be your best advocate if you've done all this thought and research beforehand. So when they say, Mr. John, what do you think is going on? That's your opportunity to say, well, I've actually done a lot of research and I think it might be blah, blah, blah. Or they say, what do you think is going on? And you say, well, I've Googled it, right? Everybody Googles their symptoms. Doctors know this, but you can say, I Googled it and I'm really concerned it's yada, yada, yada. So there's this designed healthcare or communication technique that doctors can use. And if you have a thought on your mind or a concern or a worry of what you think is going on, and they don't ask that question, here's a really simple way to prompt that. There's a moment of silence. They say, I have some thoughts about what's going on. Can I share them with you? I can almost guarantee they're going to say, sure, tell me what's going on. And that might be where you say, well, I have, my sister or my niece is a nurse and she talked to me and here are some of her thoughts and I'm really worried about that. What do you think? That could be helpful for your doctor to know, right? They might say, oh, I wasn't even thinking about that, but that's a great point. And then they'll go into their own questioning to explore that, right? Perhaps. Or this is where you might say, I looked this up. I'm really nervous that it's cancer. I'm really nervous. I'm going to need surgery. That then gives your doctor the opportunity to say, I understand there is no reason to be nervous. I am not concerned with that at all and can alleviate your stress. So there is this just piece of communication that's important to the visit. So as we move on to the end of the visit. So the beginning, they got this clear picture of your health. In the middle, they're having this really open dialogue. This is where there's some relationship building. They think they have this clear idea of what's going on with you and are going to do something called shared decision making. While it might feel at the end of your visits that the doctor just walks out of the room and you're left there thinking, okay, now what? Or what even happened, right? They just left. That's not the case. At the end of your visit, that framework that the doctor has, they have to share with you a plan of care or some form of next steps. I guarantee they're not just going to turn around and walk out of the room and say, see ya, right? I got all my questions answered. I'll talk to you later. They're going to give you some form of a next steps, even if it feels like they haven't done that. And most patients, statistically and research-wise, don't remember, right? They don't remember what the doctor shared with them. They don't like the plan of care that's provided with them. And really, there is some really bad statistics, but one recently said like 20% of patients actually do what their doctors say. And that is a huge reason for physician burnout. Or rightfully so. Doctors are thinking, well, then what's the point of this? Somebody showed up, spent the time to be here, waited, on the waiting room forever. I've told them what I think is going on, and then they leave and don't actually follow through. So a huge issue in healthcare. But what this looks like is the doctor will say, right, they've come up with the puzzle in their mind and they're going to say, here's what I think is going on. Here's what I think we should do. What do you think of that? And this is where it's very important that you fully understand what that plan of care is. So keep a lookout for that conversation because it might not look exactly like this, right? Here's where I think it's going, but they're going to say, here's what I want to do. Here's the plan of care. What do you think of that? Most patients at this point in the visit just nod their head and say, okay. And doctors are thinking in their mind, if the patient's nodding their head and saying, okay, like that's okay. But what you need to do at this point, here are my tips. Listen to the plan of care. If it sounds good to you, right? Sounds good, meaning you could do it, you agree with it, it's not scary to you. You're going to repeat back the plan of care. So your doctor says, you have back pain. I'd like you to do 4 weeks of physical therapy 3 times a week. And then let's revisit and you tell me, for a follow-up. And in your head, if you think, okay, that works, you're going to say, okay, so you're saying 3 days a week, physical therapy, for an hour for 4 weeks, and then do a follow-up. And they will say, yeah, right. You make sure you have it, you understand it, and then you actually write it down. It's okay to write it down. And again, this is my world, right? And I still do these things. I've taken my children to the doctors and the doctor, they're so quick. They say, okay, I'm going to have this, call on this medication. It's a cream, go pick it up and use it as needed. And I'll sit there and be like, okay. And then if I leave the exam room, I'll go, wait, as needed, like, what does that mean? When do I start it? Right? That's sort of the old version. Now I'll sit there and say, I'm picking up the cream and I go slowly, right? It's okay to slow them down and say, I want to fully understand this. So I'm going to give her the cream when she needs it. What does that mean? Like when I see her rashes dry, like I need to make sure that when I leave that room, right, that doctor's not following me. He's not going to help me out. So I need to make sure I fully understand that. Separately, and I'll ask those questions to clarify. So when do I do this? And then at what point do I stop giving her the cream? And again, this is my world. So I'm aware to ask questions like, when we're done, if there's extra cream, do I throw it out or can I save it and use it 6 months later? Right? All these things that I'm able to think of. But those simple parts of repeating and writing down what you have to do is crucial. As your doctor shares with you a plan of care, right? You need to do physical therapy for 3 days a week for 4 weeks. If you know that's not going to work for you, you can say, that's not going to work for me. Is there an alternative? What else can we do? They are trained to be able to have many different treatment options in many cases. And they're going to share with you often the one based on their knowledge of you, based on questions asked through that timeline, what they think is best for you. If at some point in the visit, they've learned that you are a primary caregiver, that you don't have transportation, right? Perhaps finances are an issue, they're likely going to then provide a plan of care that works best for you versus the patient who can drive, doesn't work, can go to physical therapy whenever, right? They're designing these plans of care based on what they think is best for you. So if you're not sharing concerns or speaking up, like how are they going to know what's best? So if they give you a plan that you don't agree with, you can say, can we hold on? I don't think that's going to work for me. Like, do I have other options? And sometimes you don't, but this then gives the doctor the opportunity to say, listen, I've seen this 10,000 times. I'm telling you, like, this is the best option and here's why. And then they'll explain it to you. And at least you'll feel better about what has to happen. So there's that piece of it. A couple of the questions or comments that you might say during that is things like, I don't understand. Why are we doing this? What is this medication for? What is the treatment for? What are the risks and benefits to this? Also, if you don't feel like you're ready to make a decision, you can say, can we leave things as is? I need to get more information. I'm not ready to make a decision yet. Can we schedule a follow-up visit to talk about it? Also perfectly okay. You need to feel somewhat in control of this because patient-centered care, you are a part of your healthcare team, right? So you can say these things. If you have financial concerns, or if you're recognizing that you're feeling scared or confused or annoyed, this is the time to share that. If you feel like your doctor hasn't heard you, you can simply say, I feel like there's a disconnect here. I'm not ready to make a decision, and then just leave, or say, I really want you to understand how I'm feeling, and have a conversation with these human beings. So with that said, your visit as a successful patient, I want you to think about this. I strongly feel in the work that I've done, and I've been in medical education for 10 years doing this work, I strongly feel there needs to be a shift in the patient's role where you have to shift away from just showing up to now being this prepared patient who has done some work beforehand, to be prepared to sit in the room and have this great back and forth dialogue and understanding that, okay, I'm giving them all the information needed. I'm ready for their questions. I've somewhat thought through my history. I know they're going to give me this plan of care. I'm going to agree with it or have a dialogue so that we come to an agreed upon plan of care, so that when I walk out the room, I feel like I've gotten what I needed out of that visit. Right? I feel like the doctor heard me, knows what needs to happen, and I'm going to follow through on that. Because gone are those days of those long visits, and it's rare, while it still happens, it's rare that doctors really know patients in and out. Oftentimes, you're getting sent to a specialist who has never seen you before, who has 25 to 30 patients to see in a day, and you're hopping in their room for 15 minutes. So this, I really feel, can help. With that said, I think I went a little bit over, which happens, as I love to talk about this stuff. But I want to take just a few minutes to answer any questions or